Hello, my name is Ruth, and in this short film I'm going to talk to you about how to help look after someone who's dying at home. And I'm going to talk to you about two things. I'm going to talk to you about how to help them eat if they're still able to and want to, and how to look after their mouth. As people get closer to the end of their life, we know that they get weaker and sleepier and that their body begins to shut down. And this is all part of the natural dying process. And as this happens, the desire to eat and drink can decrease. And because people are eating and drinking less, we can see that they begin to lose weight very rapidly. If the person you're looking after still wants to eat and drink and is able to, then you can offer them small amounts of soft food, and you can offer them sips of water using a teaspoon or a straw, and it's really important that they're conscious if you're doing this. It's really important that you don't force anyone to eat and drink if they don't really want to. We find that offering people small amounts of their really favourite foods can be really nice for them, and offering them soft fruits and yogurts can also help. If you are going to be helping someone eat and drink as they near the end of their life, it's really important that they're in a sitting position or they're upright, so you can help them by propping them up with pillows, and this can help them avoid choking. Witnessing someone who doesn't want to eat or drink or is losing weight really quickly can be a really hard thing to see. But we know that people often associate the provision of food and drink with love, and that lots of our happy memories can be associated with food. But we also know from years of working with people who are nearing the end of their life that thirst is something that's not normally mentioned as a problem at the end of life. We often have people who ask us about the provision of fluids through other routes, like a drip. But we also know that as people become less well, their body becomes less able to cope with it compared to a healthy body. And we know that there are certain complications, like infection at the site of the drip or infections in the blood, that can happen. And also that if you have too much fluid, something that we call fluid overload can happen, and the body can become very swollen and it can become difficult to breathe. As people become less well, we know that they start breathing more and more through their mouth, so their mouth can become really dry, and that can make people feel really uncomfortable. So you can offer your loved one ice chips or lollies for them to suck on, and we can keep their lips moist by using an unperfumed lip balm, such as this, or just using just a normal toothbrush that's wet and using it around the inside of their mouth and just onto their teeth, really gently. And it's fine to do this whether someone's conscious or unconscious. We know that as people get to the end of their life and they breathe more and more through their mouth, they can sometimes get a really sore mouth, and you can see this by seeing white patches on their gums or maybe inside their cheeks. So you can keep an eye out for this, and if you notice this in your loved one, you can contact your healthcare team for some advice. So your local hospice and GP are always available, so do call them if you're worried about anything.